the admittedly confusing stance by the White House on whether or not people should even still be wearing masks. Just moments ago, White House Press Secretary Jen Psaki mentioned that the White House continues to defend the CDC's stance on masking indoors, while several states, as you know, are undoing a lot of those mask mandates right now. So which one is it? Do we follow state guidelines or the federal guidelines? Joining us now to hopefully try and find some type of answer within this big question, ABC News Deputy Political Director Avery Harper, also infectious disease specialist at South Shore Health, and ABC News contributor Dr. Simone Wildes. Okay, Avery, help us understand the two stances here specifically. You know, where does the White House stand on all of this, and where do these governors stand, and then what do we all do? Do we wear masks or not? It's just mixed messaging.
Right. You know, what we heard the White House and White House Press Secretary Jen Psaki say is that the White House continues to stand by the CDC's guidance. So things are not changing at the White House. But where things are changing is out in states across the country. We've seen several governors move to get rid of or let those mask mandates lapse in their states. And what the White House is saying is that they encourage other states and the governors to follow that CDC guidance, while at the same time understanding that these governors are going to make decisions for themselves and their constituents based on what's happening closer to home. So I think what we're seeing here is a bit of the White House sticking to its guns, sticking to what it said that it's always going to do, but also at the same time trying not to be confrontational with some of those governors who are making decisions that really put them at odds with the White House.
All right, so Dr. Wildes, during the briefing, Psaki addressed the confusing back and forth information over varying protocol from state to state. Let's take a look at what she had to say and talk about it.
Well, again, we understand where the emotions of the country are, right? People are tired of masks. I would say not even if you look at the polling, though. There is also a huge chunk of people who still want masks, right? So it's not even that specific. It's just that, as you noted, there are some states that are moving towards rolling back or giving more choice to local communities about how they will implement these requirements.
All right, so Dr. Wildes, does the country need the same mandates across the board in order for us to beat this?
So, Kara, one of the things I will say that a lot of people are a little bit confused about what's happening right now. We have been through so much, and I think they're very close to being at the end of this. What we always say is that politics is local, so is healthcare local. I think based on what's happening in each community, you know, what are the vaccination rates, what are the booster rates, and also what's the positivity rates. I think decisions need to be based on whether or not we roll back the mask mandate based on the information we have. If there's not a lot of cases, I think it's quite reasonable to start rolling back these mask mandates at this time.
All right, so then, Avery, does the administration look out of touch here with where the country is heading in terms of lifting these mask mandates if the CDC doesn't revise its guidelines?
Well, like I said, I think that the moves by these states, in red states, we've seen this happening for a while now, but now we're starting to see blue states like New York, Connecticut, the president's home state, Delaware, also make a move to pull back on some of these mask mandates. I think that the White House is going to continue to stick by the CDC guidance. And the fact remains, and I'm no doctor, but I'm pretty confident in saying that just because these politicians are pulling back on these mask mandates, it does not mean that there is an end to the pandemic at this time. And regardless of what happens, I think voters in each of those states are going to hold those governors responsible for what happens.
All right, so finally then, Dr. Wildes, what happens if there is another wave or variant? Won't it be that much harder to try and reenact safety measures? It just seems like it's going to become even more confusing.
Kara, it will be very difficult. The past 2 years have been very difficult. We've had a lot of back and forth, but I think that we have learned a number of different lessons. And the key thing is that we have all experienced the fatigue, but if there is a new variant and we need to implement new changes, I think that's what we'll have to do. Remember, the key is to keep everyone healthy and well. Even if you're unhappy about it, that's what we need to do to make sure we get through this safely.
All right, our news contributors, Avery Harper, also Dr. Simone Wildes, thank you both so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.